The condition itself, I have an enzyme deficiency basically that interferes with my body's ability, sort of an inflammatory response, but basically, I mean, I can get swelling, and I get swelling throughout my body. Minor swelling episodes would be my hands or feet. Major swelling episodes would be in my stomach, abdominal area, possibly in my throat, which could actually be fatal. Can lead to asphyxiation. I haven't had to deal with that yet. Some people have. Some have been successful, some not so much so. We have treatment, and having the treatment is what makes the difference. If I use a non-demand treatment, so I know if I'm having an episode, I do a self-infusion, and the self-infusion gives me what's missing from my blood, and it stops my body from doing the crazy things that it does, and that in itself lets me, for the most part, lead a fairly normal, productive life. It wasn't always that way. Before I was diagnosed, and I was diagnosed over 30 years ago. I was actually 25 years old when I was diagnosed. Before that, episodes would come and go, and I spent a lot of time visiting doctors and hospitals and trying to find out what was wrong. Part of the problem is that there are so many presentations, and until somebody's able to sort of, wait a minute, all these things go together. They're all one thing. They're not individual items, and that makes a difference in the diagnosis. Because of the hereditary nature, I had my kids tested because I knew I had it. So they were diagnosed very young. And a few weeks ago we had our first grandchild. He's been tested, but we don't have the results yet. And he's tested because his father has it, which we know, and if he needs, well, like you said, so diagnosis in that case, we'll know. But for someone who doesn't have a family member or someone in their family who has been diagnosed, I'm not so sure that things are much better than they were when I started looking for a diagnosis. But maybe.